So let's talk about implant rupture for a second. That would be a complication, right? We don't know how often silicone implants rupture, because when they do, they just stay in the capsule, in the pocket. We have to extrapolate from saline implant rupture. Okay, now saline implants rupture about 0.5% per year. So if you have 2 of them, that's 1% per year. And if you live to 100 years with these implants, that's going to be 100%. So what leads to implant rupture? Well, what we found is that it's really when the implant folds up on itself and rubs, and that leads to a fold flaw. Most of the time, that's the real reason that implants rupture. So how do you prevent fold flaws? First, don't put an implant in that's not going to fit into the pocket. It's going to get smushed and rub on itself. Implant manufacturers have done a great job in the last, I'd say 10 years, 15 years, of changing the design of the implants so that we have more options for an individual's anatomy. That's very important. They've taken to filling the implants with more gel. That prevents it from folding over. And that's a great idea. In the saline world, there's an implant called the Ideal implant. That's the company. Look it up. It's a great implant. They have 3 shells inside itself that really help keep things from folding over. And their fold flaw is almost negligible. So the FDA recommends that you get an MRI every 2 to 3 years after breast augmentation to see if it's intact. My experience is that people don't do that. They go about their lives. They're busy. They're generally younger people, taking kids to soccer, going to dance recitals and ballet class. So they don't really, and moms especially, they just don't take time for themselves. You know, they don't do for themselves as much as maybe they should in many cases. But in this case, they're busy, and so they don't really want to go do that, and they don't. What happens is people generally come back when they're having an issue with something. And at that point, then we may get an MRI, we may not. It depends what the issue is. But that is the recommendation from the FDA. And I would tell you that, you know, MRIs are good, but they're not perfect for defining rupture. So people always wonder if like I get into a car accident, will I pop my implant? Or if I get a mammogram, will I pop my implant? So that's really a great question, because people worry about that. The answer is no, okay? What happens, all right? I've never heard of no, I take it back. I have heard of somebody having their implant change after a car accident, wearing a shoulder harness. I have definitely heard of people saying their implants changed after mammograms, but really what it is they're not rupturing the implant. What they're doing is they're sort of smushing the whole thing, and what that does is what's called a closed capsulotomy. It uses the implant to rupture through the capsule, and all of a sudden the implant gets softer again. Like they had a subtle little amount of capsular contracture that is now released. We used to do that surgically. We used to put people to sleep and do closed capsulotomies on purpose. It was kind of before I really, more than 25 years ago when I started practice. It's kind of a bad idea. To open a capsule that way. But the reality is you're not going to pop an implant. You may just make your implant softer. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.